To tonight's original now with in-depth reporting on a topic we've been watching. And tonight, it's those popular weight loss drugs we've been covering, like Ozempic and Mounjaro. The studies showing these revolutionary medications can have dramatic benefits. But doctors are also reporting some patients developing eating disorders or seeing them get worse when using these drugs. Dr. Akshay Syal has our story.
Cynthia Landrau has always had a complicated relationship with food. Fighting obesity since she was a kid, she was eventually diagnosed with binge eating disorder.
For me, it was obsessing about my next meal, obsessing about when my next snack is going to be. I was always thinking about food. It was like just continuous thoughts about it.
Struggling to lose weight, her doctor recommended a GLP-1 drug, part of a new class of medications used for weight loss, now soaring in popularity after being touted by celebrities like Oprah.
The superstar admitting she uses a weight loss medication.
But what happened next shocked Cynthia.
Completely changed the way I looked at food, how I felt, how I was thinking, like completely. Like for the binge eating, it like almost completely took it away.
She began skipping meals, eating as little as 500 calories a day with dangerous consequences.
I did experience like my blood sugar levels drop because I wasn't eating enough and I wasn't eating frequently enough. First time that I fainted, I was on the subway. It became more important to maintain that weight loss and to continue losing weight over fueling my body.
Doctors say Cynthia is part of an emerging trend of patients who have developed eating disorders or seen them worsen since starting the medications, which include drugs like Wegovy or Zepbound.
Particularly in the last 6 months, we've just seen an increase of new onset eating disorders or worsening of current eating disorders based off of the use of these drugs.
Dr. Thomas Hildebrandt, chief of the Eating and Weight Disorders program at Mount Sinai School of Medicine, says he's seen patients develop eating disorders just a few months after starting the drugs.
Their relationship with food then became more obsessive. Their relationship with their weight and their body also became obsessive. You start to turn into someone not like yourself.
When taking GLP-1 weight loss drugs, it's normal to have less of an appetite. This leads patients to eat less and ultimately leads to weight loss. But sometimes it can go too far.
So how do you know if patients eating less is part of a normal reaction to a drug or it crosses a line into an eating disorder?
I think there are a couple of signs. One, if you're unable to eat enough to actually maintain your nutrition. The other kinds of symptoms that we see a preoccupation with the number on the scale, the progress I'm making, and weight loss that doesn't ever really stop.
Major eating disorder organizations are now calling for doctors to screen people for conditions such as anorexia or bulimia before prescribing these drugs. In a statement, Wegovy's maker Novo Nordisk said their medications should only be taken as prescribed and trust that healthcare providers are evaluating a patient's individual needs. And Zepbound maker Eli Lilly said they actively engage in monitoring, evaluating, and reporting safety information. And if somebody is experiencing any side effects, they encourage them to speak with their healthcare provider. Cynthia is now working closely with a psychologist who has helped her get back to a healthy diet and weight. She's still taking the drug to maintain her weight, but doesn't use it as often.
I wish I would have been better prepared for the side effects that my mental health had, but I appreciated the medication has helped me reach my weight loss goals. Ultimately, I'm grateful.
Dr. Hildebrandt said that part of the problem is the lack of education and screening by doctors to find those who might be at risk of an eating disorder. For those on these drugs or looking to start them and worried you might be at risk, he recommends you talk to a mental health professional. Hallie?
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.